and tingling on the lateral side of the thigh. The name of this condition is myalgia paresthetica. It is a benign condition, but it can be very annoying. Not many doctors have heard about this, and they don't know what these symptoms mean. In this video, I will explain this burning thigh pain and how to treat it. So let's talk about myalgia paresthetica today. A small nerve that is responsible for the sensation of the outside of the thigh. The name of the nerve is the lateral femoral cutaneous nerve. This nerve does not control any muscle. Its function is only sensorial of the skin in this area. This nerve comes from inside of the pelvis, and here, around this bone, it comes out and goes to innervate the skin. So right here, where the nerve is passing over the bone, it can be subject to a lesion, a compression, or an injury. People who wear tight belts or tight underwear or who have fat adipose tissue in this area will provoke an external compression to the nerve. So the nerve is between the belt and the bone. It gets compressed and then it starts suffering. And when a nerve is compressed, the symptoms are usually numbness, tingling, pins and needles, burning pain, or electrical shocks. This is what we call neuropathic pain. The pain is usually on one side, but it can occur on both sides. How do we diagnose this problem? Since it is a sensorial nerve, we use some tools to examine the sensation in this area. We do a neurological test for light touch, for pinprick, and hot and cold sensations. We start with light touches, like a cotton ball. We examine the area of the skin where the sensation is supposed to be normal, like the back of the thigh or the front of the thigh. Then we start going slowly to the area of the outside of the thigh. And the person tells us that they have less sensation or no sensation at all. We do this from top down, down to up, right to left, and left to right. Then we repeat this test with a sharp object, like a toothpick. And we map the same area of lower sensation in the outside of the thigh. This is enough to make the diagnosis, but if we want to continue, we could now do a test with a very